So one of the most important factors if you're dealing with back pain is making sure that you're getting enough sleep. Now, a good night's sleep is going to help restore your body, help heal the tissue, your joints, wherever the issue lies. And if you're not getting a good night's sleep, then your back pain is going to take longer to get better. So keep watching this video if you want to learn some of the best sleeping postures and positions that I teach my clients on a daily basis when it comes to easing back pain. My name is Dr. Dawn Andalone, and I am a women's health physical therapist. I have helped thousands of women overcome back pain and be able to find ways, lifestyle changes and positions and also exercises in order to help heal back pain naturally without medications or surgery. And sleeping positions is, I think, one of the hardest things, because if you're not able to get comfortable in your bed and get a good night's sleep, then your back problem is only going to feel worse during the day. So sleep is super important. You also just want to make sure that if you haven't already, you get checked out by a medical doctor if you're having any major red flag symptoms like having numbness or tingling down the legs, or weakness of the legs, or even changes in bowel and bladder function, or you're waking up with excruciating back pain in the middle of the night. You definitely want to go get that checked out. But I want to talk you through some of the best sleeping postures and why these positions can be very helpful for alignment and helping ease some of your symptoms. Okay, the first one, and maybe the most common, but if you are usually a back sleeper and you do like to sleep on your back, then having some pillows underneath your knees, 1 or 2 pillows, is going to take some pressure and some strain off your lower back so it can actually relax and you can be able to sleep a little bit better in that position. If your legs are out totally straight, you may have a little more of an arch in your back, and it may compress the joints in your back and cause more irritation. So it looks like this. So I actually put 2 pillows under my knees, and therefore you can see that my hips stay relaxed. I can breathe well, and therefore the muscles in my lower back are kind of able to settle in and relax. So this would be good for someone that's used to sleeping on their back. Then the next position, and maybe this is the most common, and usually people switch from side to side, but not quite sure which side feels more comfortable. So find the side that you favor toward, and you can actually get a better night's rest. And you're gonna place a pillow in between your knees. This is very important because it aligns your hips, which therefore, when your hips are aligned, you're gonna have less pressure and tension on either side of your back. It looks like this. So therefore you see I have a pillow in between my knees, a pillow under my head, and therefore my hips are stacked on top of each other, and I can allow my muscles to relax a little bit better here. Sometimes it helps to even have a pillow in front of you to kind of cradle and hug a pillow in front. But you may find that some people struggle with keeping a pillow in between your knees. You do get used to it. So I promise, try it out and you will actually enjoy it after a while. It just can't be too thick of a pillow because you don't want your hips open too much. You want to have a pillow with, you know, a little bit wider, and therefore it's able to cushion and support your knees, and your back can be aligned in a better position this way. Then next thing I'd like to mention is I really advise people to not sleep on their stomach. If you can imagine and take that position to a standing position, if you're sleeping on your back, your head is tweaked to the side, and you're gonna have a bigger arch in your back. It's gonna put more pressure, and it's going to be very hard to get out of that position when you've been in that position for multiple hours. So I do advise getting out of a position in your stomach. You can use that for an exercise if you do this periodically throughout the day and you go onto your stomach, and it actually relieves some of that pressure and it feels good because you're reversing that posture. You can do that throughout the day, but just don't sleep like that. It's going to compress the joints and you can't get enough blood flow and circulation to the area around your back. So I do advise not sleeping on your stomach. Now, we also love to advocate the use of pillow-wise pillows, and this is something that we sell actually in our studio, in our office. And pillow-wise pillows are only by a medical practitioner, where you can actually get 3 measurements around your neck, from your head to your shoulders and across your shoulders, to find the right size pillow for you. And this can be very helpful for people with neck or back or shoulder pain, because they're going to be not crunching their neck and in an awkward position. It's actually going to be fitted right towards you, and it has a memory foam too, so it's actually very comfortable and therapeutic. I can't sleep without mine. I actually take it on vacation and travel with it, because I find that I wake up and my neck and my back aren't as stiff if I'm using the right pillow. So go check out that link if you are interested in pillow-wise. You can contact us and we can send you a way to get your measurements and figure out what color you are, and we can actually drop ship it to anywhere in the US as well. So I also just want to mention there's no perfect mattress. A lot of people ask me what type of mattress should they have, if it's too soft, too hard. You really got to find what's best for you. But I can definitely say if your mattress is too soft, you're going to be in a more crunched position, and sometimes this can be more harmful. If you are someone that does experience back pain, you can actually be more stiff and sore if you're using a softer mattress. So I also want to mention that it is important to find a routine at night that you're getting a lot of relaxation and maybe even doing a couple stretches before bed. I find that these can be helpful if you're allowing those muscles to relax and the tissue to relax, and therefore you get a better night's sleep that way before you get into a position. So here are 2 things that I would recommend doing. So I am on my back, and I'm just going to do some deep breathing exercises, having my knees bent. And I'm going to breathe into have my hands over my stomach, and I'm going to take a deep inhale into my hands and then exhale through my mouth. And just slow down your breathing. This allows your back muscles to relax and take any of that unwanted tension out. So doing this for a few minutes before you fall asleep is some deep breathing exercises, like 5 to 10 times. You can also do some gentle rocking with your knees side to side. Unless that is too painful, don't do it. But this also too gets your hips and your lower back to relax a little bit. Or even taking one knee toward your chest, just gently there. This may be a good idea too, first thing in the morning before you get out of bed. So once again, just a little recap. If you sleep on your side or on your back, use those positions to ease some of your back pain and allow your tissue to actually relax and be able to heal your back in a faster way by getting into some of these positions. And then making sure you're following a bedtime routine of relaxation, promoting that with some gentle stretches and some breathing exercises. Now, if you want to learn more about tips on how to ease your back pain, I would invite you to hit subscribe. I release new videos every week, and I'd love to have you watch more on some tips that help you live a more active lifestyle and help ease some of your symptoms that you're having. So I hope you found this helpful, and thanks so much for watching.